The education partnership for asthma.
We're short on time, so we're just going to finish up. Allergen immunotherapy, does it work and is it proven to help asthma? Well, actually, it is proven for cat, dust mite, grass, and ragweed pollen. So there's reason to use that possibly as a treatment in certain people, if those are the allergens causing their asthma. Anti-IgE monoclonal antibody Xolair will be available in year 2002. That takes that IgE that I told you before people make too much of, or most asthmatics make too much of. It'll take it out of the body. That'll be an injection that'll be available. So that'll give us another option for some people. Down the pike will be other, or down the turnpike will be other immunologic treatments in the future, hopefully. Component 4, just this is the last slide, education for partnership in asthma care. And really for you as the healthcare consumer need to work, basically what the NIH says is work with, to us, they're saying work with the patients, communicate, individualize, and emphasize what the goals and the outcomes are, and encourage family involvement. And thank you. Now I guess we'll do questions.
That was quite a complete lecture, which should take a week, not one evening. We're going to be passing out some cards. I think you all have them, and we'll collect them. And of interest, I'm going to bring up just a couple points, which just attending a meeting regarding, and that is people with allergies, nasal allergies or rhinitis. 40 to 50% of them develop asthma years later, so it'd be quite important to control just nasal allergies. And this here is rather recent data. The questions should be addressed to either speaker, and I'll just look at them and we'll see if I can read it. I think you write better than we do. Sure, can you write out this question on a card? Because yeah.
Well, I think almost everything we talked about really applies to adults as well as to children. There are certain special features about dealing with children as far as what medications can be given and dosage of medications, but the underlying pathophysiology is really the same. When you have older patients, you often have overlapping syndromes, such as patients with emphysema and asthma, emphysema and chronic bronchitis, asthma and cardiac problems. There are a lot of different medical conditions that can overlap and influence the presentation of asthma in the adult and in the senior population.
I'm going to, they didn't address to whom, but so we'll just throw out some of the questions here. Can you tell me about the new inhaler, Advair Discus, which has now been FDA approved, I think 2 weeks ago? You want to talk, one of you want to mention it?
Yeah, Advair is that long-acting beta agonist Ceravent, and it's Flovent. The GlaxoSmithKline, who's marketing it, is marketing it. Well, we'll ignore what they're marketing it as, but the medical letter is a little thing I read that tells without advertising, so it's kind of pure.